Hey guys, my name is Jose Torres. I'm one of the surgical persocists from TGH and lead tech, and I also am an eye tech. So today I'm going to do a quick demonstration on how to set up the vitrectomy machine, the Constelation to be exact, and we're going to just walk through how we do it here at TGH, okay? The first thing I want to show you guys is the actual Constelation pack right there. That should be the label that you guys should be looking for. Okay, and what we use here is 25 gauge systems. So when you open these, everything will be sterile, and this all goes on your peel. So you basically open it and throw it on your peel. I will demonstrate shortly what comes in the pack here, okay? So what comes in the pack is basically the cassette that attaches to the machine. I will demonstrate all of this. Your infusion tubing, your ports, an infusion tip. This is a drape for the screen. Light source, aspiration tubing, or IA tubing. This is the tubing that goes from the bottle or the bag to the cassette. And this is your cutter vitrector tip. Now when you set these up, this is all in the sterile fashion. So this will be on your field, and from here you either set it up on the arm of the vitrectomy machine or on a Mayo stand. So I'm going to demonstrate how to do that. So let me just give you a quick walkthrough on how the screen will actually look. So this is what the screen will actually look like. It'll give you, the first thing to do is to select the doctor. We're just gonna select a default doctor here, and then select what they're doing, usually vitrectomy. And as you can see, we have to increase the pressure, the inlet pressures, the nitrous coming off the wall. This usually wants to be between 95 and 110. If you go higher than that, it will give you the alarm saying that it's too high, and the box will turn red. Right now, since it's not enough pressure, it's on yellow, and once I get to the pressure that is needed, it will turn green. Let me show you guys that right now. Alright, so I'm going to go ahead and increase the pressure, and I'm just increasing the pressure from the wall. I'm trying not to shake. See, once I hit 99, 102, 103 there, the box turned green, and that is the right gauge you want to be at pressure-wise, okay? Alright guys, so as I said, for this example, I'm going to go ahead and set up the arm from the machine, but you can also set this up on the Mayo stand or just straight onto the patient on the bed, on the table, once it's all set up, once the patient is draped. This is just one way to do it. There's a couple of different ways to do it. I am going to demonstrate the arm on the machine. Obviously, you don't want to hit your back table. And then you would take this arm and you would drape it with a Mayo stand or any plastic, like a C-arm cover would probably work, or something along those lines. There's an actual drape that comes for this, but we don't make it, we don't order it, but we can use a regular Mayo stand cover, okay? So I'm gonna put a gown and gloves just so I can do the demonstration. I'm not gonna wear a mask, so that way you guys can hear me better. But that's what we're gonna do now, and I'll show you here in a second. Alright guys, so we're gonna go ahead and drape this arm here. Then you can also ask your circulator, once this is kind of here, you can just ask them to put a little piece of tape there to hold this from the Mayo stand from dripping, okay? These has little bars here that you can create some pockets. You can just open them, create a pocket, and then close them. Helps to tuck things in there. Okay, so the first thing I'm going to do is connect the cassette. The cassette is very simple to do. Once the machine is activated, it only fits one way. Okay, and basically all it does, you just attach it there from the bottom, put it in slowly, and the machine will suck it in. Alright, so once the cassette is hooked up, everything else is basically very simple. Everything is color coordinated here. So everything on the cassette, on the light blue, you have the light blue tubing. Just like that. So you can start hooking them up, and you can do this yourself. And it's just a small right turn, and it clicks. You'll feel it. You don't have to force it. It's very, very, very soft touch. Your irrigation from the bottle to the cassette, from the bag to the cassette, red and gray. Your infusion line, green and white. Same thing, softly. Little quarter right turn. And it doesn't matter what order you guys put this, okay? And then your vitrectomy. And this one of them goes into cassette, but the other two go onto these function buttons over here. I'll show you how to connect them shortly. Same thing, slow right, and these, black on black, gray on gray. You can do this all sterile yourself, okay guys? So, small push in, small right turn. Small push in, small right turn. If I put it in the wrong spot, it will turn amber, saying that is not the right spot. So that's your signal to know that you're in the right spot. Green is go. Alright, so now let's go ahead and put the screen cover in a sterile manner. And also this is your light. Your light pipe. So same thing. Once we attach it there, the light comes on green. Alright, so once the light pipe is done, now you're ready to pass off the red and clear line, which is the spike, to the nurse. From here, you just hand it to the nurse in a sterile fashion. The nurse will just grab it from you. I'm going to pretend like I'm the nurse. She would take the spike off, the cover off, wipe it with alcohol, wait 3 to 5 seconds for the alcohol to dry, and then she would spike the bag. So, I'm spiking the bag. Give it a couple presses. You want the chamber to be about 2/3 of the way full. Okay? And now, I will be ready to prime. So I need a cup. And I will find a cup here shortly. Alright, so at this point, now your spike, you grab one of your small specimen cups. It'll be smaller than this one. And basically you are ready to prime. Right on the top, on the center here, it says start prime. Everything is connected, everything's ready to go. All you have to do is hit start prime. Alright, so I'm gonna hit start prime here. That is some of the sounds that it makes. And I will be holding the line. Also, before you start the prime, actually go ahead and attach the infusion line, okay? As you see, I attached the infusion tip cannula. It's going through the progress bar. It will definitely put some fluid in your specimen cup, which you can use later for other things. And here you can hear the vitrectomy cutter priming.
Vitrectomy.
And the machine is ready. That is the setup. So at this point, guys, you just basically pass this off, secured all these things with a hemostat on the corner or something. And then when you're ready, you can either rotate this whole table over the patient and pass the lines off, or just transfer these over onto the patient and leave this on the side, however you guys want to do it. You can do this with a Mayo stand, or however you guys want to do it. It all depends on the room, the settings, and how everything works in that room, okay? So, but that is your basic vitrectomy setup. I hope that helped, and I'll see you guys on the next one. Thank you.